NHS Grampian, we cover the whole of the North East of Scotland, including the Shetland and the Orkney Isles, and down as far as Dundee.
We only had 2 sets of keys that had all of the keys for the whole ward on each set. So obviously it was very difficult when you've got maybe 4 members of staff all looking for different keys and different drugs in different cupboards to get them all open. So it was delaying patients' medications, and a lot of time was spent going around asking people, have you got keys? I need keys, and which delayed a lot of patient care.
We did an audit on patient administration of medication, and one of the audit was a delay in patients getting their medications because staff were having to chase each other to find the keys. So we spoke about the keys. There was 2 sets of keys. So if you've got 6 members of staff and 2 sets of keys, you can understand that you spent a lot of time trying to find that member of staff to get the keys to go and do. So we've got IV cupboards, oral medications, all different cupboards, all on 2 bunches of keys.
We looked at getting more sets of keys, but we felt that was probably just it's solving a little bit of the problem, but wasn't going to solve it completely. And it was Michelle Morris, another senior staff nurse, she went to an induction day about the Traka21, and it was from there that we kind of took it on as a project to try and get it on the ward.
So there are risks to getting more keys, so it solves a problem, but the greater risk is that you've got more keys, more risk of them getting lost and other people getting inappropriate access to the keys. So there are risks to just getting more keys, and a cost obviously as well.
But we were attracted to the unit because you can monitor who has the keys, you can see who's taking keys out, what time they took them out. You can also limit access, so some of our students, we can allow them to have access to some keys, but not obviously into our cupboards with other medications that they don't need to come into. 1 unit installed on this ward, and that's within RACH, but I have been contacted from a couple of different wards, so the medical ward and the neonatal unit have been in contact with myself regarding getting it. Hopefully they'd like one as well. It's all been very positive, hasn't it?
Yeah.
Everybody's really liked it, and people that have come onto the ward from different areas they've really liked it as well. They think it's quite an efficient way to work.
As a senior charge nurse, I'm responsible ultimately for the security of the staff and the patients. I'm reassured that there is a robust system in that I can check who's got the keys. I know I can, if there is any errors or any incidents, then I have a far more robust way of knowing who's had access to my keys.